Hello guys, I'm JJ from the Radio Tech Academy channel. Today I'm here with a new video. In this video, I want to take a comprehensive, simple and practical look at the overall structure of a radiology machine. Here, we are not going to get into specialized explanations, complex parameters, or deep technical details, because for each component of the radiology device, we will make separate videos in the future, and there I will explain everything for you from A to Z. The goal of this video is first to form a general picture in your mind, to understand what parts a radiology machine is made of, what role each section plays, and how these components together create a complete imaging system. This video is actually our roadmap for continuing this playlist. So guys, if I want to explain it simply, a radiology machine is a combined system made of three main categories of components. One, mechanical components, such as motors, rails, arms, movement, and stopping mechanisms. These help the tube, table, detector, or wall stand to be positioned exactly where we need them for imaging. Two, electrical and electronic components, such as generator, tube, cables, high-voltage circuits. These components are responsible for generating, controlling, and transferring the energy required to produce X-rays. 3. Control and software components, such as device console, exposure systems, including AEC, IT systems like PACS and RIS. These sections handle the management, storage, and processing of images. Up next, we will go through these one by one, but not in deep detail, just enough so that you understand what we're dealing with. 1. Generator. Simple introduction. The generator is essentially the electrical heart of the system. It takes standard mains electricity and converts it into highly controlled voltage and current so that the tube can produce X-rays. The three key parameters the generator controls are kV, which determines photon energy, MA, which determines the number of electrons and therefore the number of photons, and time, which adjusts the length of the exposure pulse. Modern generators are high-frequency type. They have lower ripple and provide a more stable and smoother voltage. The result of this stability is less image noise and the ability to capture images with lower dose. From a practical standpoint, when the generator is unstable or has voltage drops, the image becomes dark or low contrast, and the technologist must troubleshoot quickly. An experienced technologist can tell whether the system is healthy just from the generator's behavior. For example, a drop in kV during exposure is one of the common causes of reduced image contrast. In future videos, we will talk about the different types of generators, the concept of ripple, and how it affects the image. 2. X-ray tube. Simple introduction. The tube is the place where the X-rays are actually produced. The main structure of the tube includes the cathode and the anode. The cathode produces electrons, and the anode is the target where the electrons strike and X-ray photons are generated. Most of the energy delivered to the tube is converted into heat. Therefore, the anode must have a high heat capacity. In modern tubes, a rotating anode is usually used so that the heat is spread across a larger surface, increasing the working capability and lifespan of the tube. In terms of image quality, parameters such as focal spot size determine sharpness and clarity. Also, operating conditions of the tube, such as long consecutive exposures or improper warm-up, can cause damage or reduced performance. In future specialized videos, I will explain the internal components of the tube, its cooling principles, and its proper maintenance in detail. 3. Filtration. Filtration means removing low-energy photons that have no diagnostic value, but increase the patient's skin dose. Filters are usually made of aluminum or similar materials, and can be inherent, meaning built into the tube structure, or added, meaning positioned before the beam exits. The goal of filtration is to increase the average energy of the beam, to raise the HVL while reducing the patient's surface dose. Patient protection standards define the minimum required filtration, and this is part of the system's quality control. In some applications, special filters or pediatric filters are used to reduce dose in young patients. In some modern collimators, the pediatric filter is built internally so that pediatric imaging can be performed with proper dose without physically replacing the filter. 4. Collimator. The collimator's role is to limit the radiation field, meaning it determines where the beam goes and where it does not. This reduces dose to unnecessary tissues and decreases scatter, which results in increased image contrast. The structure of the collimator consists of several pairs of lead shutters that move crosswise to enlarge or reduce the radiation field. Usually there are two main pairs of shutters, often called blades. By turning a knob or lever, the shutters move closer together or farther apart, and the size of the light field changes. The light coupled to the collimator allows us to see the physical area on the patient before exposure and to adjust it precisely. Also, the accuracy of congruence between the collimator light and the X-ray beam is essential. If this alignment is incorrect, part of the intended anatomy may fall outside the field, or the patient may receive unnecessary exposure. 5. Table. The table is where the patient is positioned and is one of the key components for positioning. Tables must be radiolucent so they do not interfere with the X-ray beam, and they usually have longitudinal and lateral movement, and in some models, tilt capability. Under the surface of the table, there is usually a bucky that is used to hold the grid and the detector. The design of the table must provide safe locking, proper weight capacity, and smooth movement, because precision in positioning has a direct effect on image quality and repeatability. In many facilities, mechanical issues with the table are among the most common causes of malfunction or repairs, and regular maintenance must be performed. 6. Wall stand. The wall stand is used for upright imaging, such as chest radiography, vertical spine exams, or studies where the patient needs to stand. The wall stand allows height adjustment and secure locking, so the detector or bucky can be positioned at the correct height. In wall stands, alignment between the tube axis and the center of the detector is also important to reduce distortion and image errors. For this reason, newer wall stands use synchronization capability. 7. Grid. The grid is a device used to remove scattered radiation and increase image contrast. Its structure consists of thin lead strips with spaces between them. Primary photons pass through these gaps, but scattered radiation is usually absorbed by the strips, which improves image quality. There are several key parameters in a grid. The grid ratio is the ratio of strip height to the distance between them. The higher it is, the better the scatter removal. But the grid becomes more sensitive to distance in alignment with the tube. Line density refers to the number of lines per centimeter. The higher it is, the less likely the grid lines will be visible on the image. Focal distance is the distance for which the grid is designed, and if not followed, image errors occur. The interspace is the material between the strips, usually aluminum or fiber, which affects absorption and grid weight. Grids are used in both fixed and moving configurations. Fixed grids are commonly seen in modern CR and DR systems. Moving grids were used more in older systems. At the moment of exposure, a motor would move the grid so that the grid lines did not appear on the image. Because if the grid is stationary, the strips may appear as fine lines on the image. In summary, the grid is essential for thick body areas, and proper use increases contrast, but unnecessary use only increases patient dose. Therefore, knowing the grid type and maintaining correct distance and alignment is very important. 8. Digital imaging systems are divided into two main categories, CR and DR. CR, or computed radiography, uses a phosphor plate that must be read inside a reader after exposure. This system is suitable for gradual upgrades from film-based systems, but it is slower than DR and has lower sensitivity performance. DR digital radiography. DR, or digital radiography, uses direct digital detectors that send the image almost instantly to the console. These systems usually have higher DQE, produce less noise, and overall allow faster workflow and lower dose. The choice between CR and DR depends on budget, workflow needs, and the clinic's IT infrastructure. 9. Exposure System plus Automatic Exposure Control AEC. Exposure System. The exposure system includes the console and circuits that send the exposure command and set the kV, MA, and time parameters. Automatic Exposure Control AEC. AEC is a major aid for the operator. Its simple function is that instead of the operator manually determining the exposure time, cells are placed in the path of the detector or under the plate to measure the amount of radiation. When the required exposure to reach the target density is achieved, the AEC automatically stops the exposure. One of the advantages: it reduces operator errors in setting exposure time and produces more uniform image density. One of the limitations: proper AEC function requires precise positioning of the cells relative to the anatomy of interest. If the AEC sensors are placed over the wrong area, or if the patient has a prosthesis or metal object, the result may be underexposure with noise or overexposure. Therefore, operator training and regular quality control of the AEC are very important. 10. Control Room. The control room is where decisions are made and the entire imaging process is managed. From this room, the technologist selects parameters, sets the anatomical program, activates or deactivates the AEC, and reviews the image preview. On the console, you can see the histogram and exposure index of the image, which indicate whether the image exposure is within the appropriate range. Here, the technologist also selects the grid, filters, and even sends the image to PACS. The operator's technical experience in the control room helps reduce repeated errors, choose the proper technique, and consequently lower patient dose while improving image quality. 11. IT Department, PACS, RIS, Networking. We examine the IT sections separately because in today's digital world, IT is practically the backbone of the imaging process. PACS is the picture archiving and communication system that stores images in DICOM standard and sends them to workstations. RIS is the radiology information system that manages requests, reporting, and scheduling. These two systems must be integrated with the hospital HIS to ensure proper workflow. Network infrastructure, servers, routers, and backup and redundancy policies are essential to prevent data loss and maintain information security. Without proper IT, even the best machines cannot effectively make images available to physicians. Without an IT system, the machine is practically ineffective, even if it has the best generator and tube in the world installed. Final summary. So guys, the radiology machine is made up of several seemingly independent components, but in practice, all of them must work together like an orchestra. The generator provides energy. The tube produces X-rays. The filters and collimator shape the beam. The table and wall stand position the patient correctly. The grid controls scatter. The detector captures the image. The AEC intelligently controls the dose. The control room manages everything. And finally, PACS RIS integrate the image into the diagnostic workflow. So guys, our video ends here. As we mentioned at the beginning, this was just a basic overview. We only wanted to give you a glimpse of what components make up a radiology machine. If you enjoyed the video, please like it. If you found it useful, share it with your friends. And don't forget to subscribe to the channel, because in the upcoming videos, we will explain each component of the radiology machine step by step. Subscribe and hit the bell so you don't miss anything.